Why do kids get so many ear infections? Ear infections are the most common infections of childhood. To understand why children suffer from so many ear infections, let's look at the anatomy. Here we see the ear canal and the eardrum. Behind the eardrum is the middle ear. This airspace connects the ear to the back of the nose and throat through the eustachian tube. Ear infections often start when nasal congestion causes fluid to build up in the middle ear. Bacteria then infect this fluid, causing pain and fever. The fluid can't drain through the ear canal unless the eardrum ruptures. To fully resolve the infection, the bacteria must be eliminated and the fluid must drain. Children are more prone to ear infections because their anatomy hasn't fully developed. Their eustachian tubes are shorter and flatter than adults. This increases the risk of fluid backup and makes it harder for fluid to drain out of the ear. As we grow, our eustachian tubes lengthen and become more vertical, improving drainage and reducing chances of fluid backing up. Many children suffer recurring ear infections due to lingering fluid from the initial infection. Antibiotics clear the bacteria but don't remove the fluid. When the fluid doesn't drain after a first round of antibiotics, it frequently gets reinfected, restarting the cycle and requiring repeated rounds of systemic antibiotics. Ear tubes break this cycle by allowing fluid to drain out of the ear and into the ear canal. In this surgery, we make a small hole in the eardrum, suction out any fluid, and then insert the tube. In bypassing the eustachian tube, ear tubes provide an alternate pathway for fluid drainage, preventing fluid buildup and minimizing pain and discomfort. Children with ear tubes typically have fewer ear infections and are better able to manage any infections they may get. With ear tubes, ear infections can be treated with topical antibiotic ear drops, avoiding the need for systemic antibiotics and their risks and side effects. Ear tubes are temporary and are designed to stay in the eardrum for about 6 months to 2 years. Over this time, your child will grow and their eustachian tubes will develop. When the ear tubes eventually fall out, the eardrum should heal on its own. Since time has passed, their risk factors for continued ear infections is less, and most children never need a second set of tubes.